And it is now my pleasure to turn the program over to Senator Bartolotta. Senator?
Thank you so much, Andy. And you explained it extremely well. And I'm just going to highlight some things that the legislation does. And I'm very proud to sponsor this legislation to help out our hospitals. As Andy stated, I'm Senator Cameron Bartolotta, representing the 46th Senatorial District in the southwestern corner of Pennsylvania. Rural areas, like the ones that I represent, rely heavily on the local hospitals to meet the healthcare needs of our communities. The long-term health of rural Pennsylvania depends on these facilities. Commonwealth-wide, 11% of our residents live in rural areas, which equate to more than 1.4 million people. According to a 2019 data from the Health Resource and Services Administration, Pennsylvania has 69 rural health care facilities to cover those 1.4 million people, and they are critical. According to a report from WHYY, nearly half of rural hospitals in Pennsylvania operated in negative margins in 2019, pre-pandemic. The Pennsylvania Department of Health has warned that there is a real danger of many of these facilities closing. Throughout the COVID-19 crisis, I saw my district's hospitals take a leadership role in testing, treating, and vaccinating our communities. These generational organizations have adapted time and time again, writing yet another chapter of their important story that started long before the pandemic and must continue for years to come. In recognition of the essential role that rural hospitals play in meeting the healthcare needs of many Pennsylvanians, I'm proud to sponsor the PA HEROES Act in the Senate. Our hospitals always put us first, and now it's time to ensure that they have the tools they need to continue to serve us. This legislation will make sure that we maintain a strong public health infrastructure in our hometowns. It empowers our hospitals to find innovative solutions and develop key partnerships to keep our public health system strong. There is no greater example of a deep legacy for the hospital and community he represents than my good friend Lou Panza, the CEO of Mon Valley Hospital. No, I just wanted to add that this is, again, as you said, Andy, it's a grant program with this influx of federal funds, and it's going to be very scrutinized. You have to, these hospitals have to demonstrate need. They have to also prove that they can't get that funding elsewhere, and it's going to be highly audited and very responsibly reported. And one of the issues that has really been a crushing blow to Mon Valley Hospital is that it's been somehow considered an urban hospital. Has anyone been to Monongahela? So we're trying desperately to get that designation corrected because it's a very rural entity, and because it has the misclassification, this hospital has not been entitled to some very substantial federal funding, which would have provided a huge relief. And to Lou's point, I was there in the beginning of this crisis last year, and this hospital had to spend, much like many other hospitals, tens and tens and tens of thousands of dollars to create new negative pressure rooms that they didn't have before. So the expenses were exorbitant. The income was reduced dramatically, and this has left a chasm that is almost impossible to cross. So this grant program, I believe, will go a very long way into healing that disparity. So I'm very, very happy that we're looking to do this. And I know that there are so many other legislators that are in the same boat. So I foresee this moving quickly through both chambers and hopefully to the finish line, because this is something we absolutely have to do to correct a problem and to literally give a lifeline to our hospitals.